All right, hi guys. We are going to be doing a practical exam looking at the posterior pharynx here. Okay, I've done 3 questions, A, B, and C. Okay, kind of similar to how they would in the practical exam. Notice how I've done 1, 2, 3, 4, 5, and there's 2 cadaver images here, just with minor anatomical differences. So the red arrows on the left versus the blue arrows on the right show the same fibers, but some a bit more superficial, some a bit more deep. Don't worry about that too much. It's just to give you a rough idea of where we are in the posterior pharynx, okay? So if you want to have a go, pause the video now and tackle these questions A, B, and C. And if not, stay here and we can cut to the chase. And we're going to tackle question A right now, okay? So identify muscle 3. So I'm going to circle this one here, 3. All right, 3 is kind of present here in A, but it's mainly in B over here. So for question A, muscle 3, this is your inferior constrictor, okay? Inferior constrictor, okay? Which kind of gives away what 2 and 1 would be. 2 would be your middle constrictor, and 1 would be your superior constrictor. And these are your 3 constrictor muscles of the pharynx. Now we're going to look at B. What is the innervation to muscle 4? Notice that we have 4 on the left, 4 on the right. Okay, it's the same muscle. It just looks a little bit different depending on which cadaver you're looking at. But it should be a dead giveaway given how it splits your superior and middle constrictors apart, okay? So this is going to be your stylopharyngeus muscle, okay? But we don't want to know what muscle it is. We want to know the innervation to it. Lucky for us, all of the muscles of the pharynx are innervated by the vagus nerve, except for this one. So this is our exception. This is cranial nerve 9, and then we call that our glossopharyngeal muscle, okay? Pharyngeal. Perfect. Okay, and these actually run side by side as they come from the styloid process. It's very nice. Now finally, identify bone 5. We've got 5 here and 5 here, okay? Notice how bone 5 splits the inferior constrictor and the middle constrictor, okay? That should be a dead giveaway. That is our hyoid bone. Perfect. Okay, and then these are just the greater horns that are poking out here. Okay, so greater horn. Okay, so we've gone through every single muscle, and we've gone through questions A, B, and C. All right, guys. Now on to the second cadaver image for the pharynx. This is question A. Identify hole 1. B. What muscle originates from hole 1, and C. What pharyngeal muscle originates from 2. Okay, so if you want to have a go, you can pause now. If not, we can tackle the questions head on. So identify hole 1. Okay, so I'm just going to highlight it in green here. Okay, so this is your eustachian tube. Okay, eustachian, make sure I spell this correctly. Tube. Okay, and it is the tube that connects the middle ears to the back of your throat, and it helps drain fluid and also balance air pressure. If we look at B now, what muscle originates from the eustachian tube? Okay, so it comes down here, all right, it goes all the way to your pharynx. Okay, it's called your salpingo pharyngeus. Okay, so it goes from your eustachian tube all the way to your pharynx, your salpingopharyngeus. And finally, what pharyngeal muscle originates from 2? Okay, 2 is this one right here. And we're looking at the soft palate, okay? And notice how it says pharyngeal muscle, okay? So from the palate, obviously you got like palatoglossus, but for the pharyngeal muscle that originates from 2, it is going to be your palatopharyngeus. Okay, perfect. Now, altogether, we have tackled all 6 muscles of the pharynx, okay? Your 3 constrictors, and then your 3 longitudinal ones. That includes your salpingopharyngeus, palatopharyngeus, and then the one from before, okay, your stylopharyngeus. I hope this helps, okay? Good luck.